Hey everybody, Dr. C here. Today I'm going to start a new series on what I see patients doing for themselves that seems to be most beneficial. I'm going to talk to you today about 3 or 4 issues that I observe that is universal among patients that seem to get better. These are the patients who come in with recalcitrant chronic pain. They've tried everything, nothing is helping them, and they're incredibly frustrated with their situation. They all seem to follow the same basic progression. The first thing that happens is they decide they're unhappy with their situation. They've gotten very frustrated with where they are. They're unsatisfied with their function. They're unsatisfied with their pain control. And they decide to make changes. And rarely is this prompted. It just happens. The first thing that I see them do is they start to reduce their medications. They arrive at the determination that whatever they're doing isn't beneficial. They're frustrated that they're tethered to these medications. The medications leave them feeling bad, and they start to discontinue them. Usually these are opiates, and I'm going to go into greater detail on opiates in the future, but the first thing that I see my patients do who get better in the long run is they quit taking medications, all medications. They reduce and eliminate their opiates. They reduce and eliminate most of their other controlled substances. They reduce and eliminate most of their other prescription drugs unless there's a very good reason to remain on them. Most of them will discontinue their over-the-counter meds, their anti-inflammatories and that sort of thing. And if they're using illegal substances, they'll generally decide to discontinue those too. This is unprompted. It doesn't seem to work very well. If they're being told that they have to do these things, then they resist it, they resent it, they tend to move on and find people who will provide them with what they want. But when they reach the point where they're just no longer happy, I guess they've reached rock bottom, then they will discontinue medications, and that's really pillar number 1 that I see. It's detox. The patients who tend to get better in the long run decide to detox. Once they detox, then they start to become more active. And it's pretty interesting how these two things go hand in hand. First, they get up in the morning and they don't feel hungover, or they don't feel excessively tired, they're not reaching for medications, they don't feel impaired, and so they actually go out and they start doing something. Most of them will tell me, yeah, I stopped taking so many medications and I started feeling better, so I started getting out and doing things. It isn't necessarily an exercise program that they do, but they get out and they get moving. They'll go watch their kids play sports and they'll walk around the track while the kid is participating in their activities. They'll go out and they'll start walking the dog, or they'll start taking walks with their families. Maybe they'll go on bike rides on the weekends. But little by little, they start increasing their activity. I've termed this pillar, or this change in behavior, the ambulate section of long-term pain relief. So you've got to detox, and then you've got to start to ambulate. Ambulation means specifically walking, but I'm using it in a much broader sense. I mean, get up and get moving. Go out and start getting some exercise. Go start taking better care of yourself physically. The next thing that they do as they get more active is they start to realize they're dry, they're dehydrated, they haven't been drinking enough fluid, they haven't been consuming enough water. They start drinking much more water. They hydrate. And as they hydrate, that improves cellular function. Their bodies start to feel better. It improves their performance. And as they start to hydrate, they start to feel better. Their cellular function improves. Their performance improves. They're able to do more actively, and they feel better overall. So they'll come in and they'll tell me, yeah, I started just drinking water or drinking electrolyte solutions. Some of them start drinking alkaline water. It doesn't really seem to matter what they drink, as long as they start increasing their fluid intake. This is hydrate. So they detox, they ambulate, they hydrate. And then the fourth thing they do, I call meditation. They meditate. And this isn't necessarily sitting cross-legged on the floor, staring at your navel. It can be just thinking while you walk, or learning to clear your mind. They become much more mindful over time. They stop worrying about well, what if I do these things and it makes my pain worse? And they just start doing more and more activities. And as they do, they learn that it doesn't really hurt their bodies. In fact, it improves the function of their bodies. And they feel better and better. They learn not to focus so much on their pain or concentrate on how they feel or how miserable they are or how much having pain every day sucks. And they just get busy and get active. They start to forget about their pain. Their pain actually gets better as they get more active and as they get more hydrated. Their pain has gotten quite a bit better for a variety of reasons after they got off all of the pain-killing medications, paradoxically. And they are almost to the point of recovery. Some of them will continue to use caffeine, and they'll find that it just gives them a little bit of boost. And there are some chemical reasons to use caffeine. It's probably the only medication that I would recommend you remain on of the pain relievers as you go through your journey of pain relief. But it's not critical. I wouldn't consider it a main pillar of pain relief. It's more of an adjuvant or a catalyst, but it is very beneficial. Combined with the meditating pillar of pain relief, they also spend a bit of time exploring what's causing their pain. It's important to get a diagnosis or at least rule out dangerous conditions as you begin this journey for pain relief, because if in your mind you're concerned that you're going to break, or that if you do get active, something bad is going to happen and you're going to completely lose function, it's a huge barrier to increasing activity. So a diagnosis is important. It's not always possible to diagnose the source of chronic pain, but it is usually possible to make sure that there is nothing nefarious going on. We can reassure you that nothing's broken, that you don't have cancer, that you don't have any structural damage that needs urgent repair, and that it's safe to continue on with your increasing activities, and it's safe to discontinue these medications. Although for the most part, I can think of very few reasons why it wouldn't be safe to discontinue most pain medications as long as you do it carefully. If somebody's prescribing them to you, it's probably a good idea to get them to help you get off of them. But I've seen lots of patients just say, well, I ran out and I decided I didn't want to take them anymore. And I didn't really notice any change in my pain. In fact, I felt a lot better after a few days. And so I decided I just don't need them anymore. So we've got a diagnosis, or we've ruled out dangerous conditions. You've managed to detox. You're up and you're moving and you're more physically active. You're getting well hydrated. You're learning how to not focus on your pain. And once you achieve all of these things, what I see is most patients just disappear. They stop following with me. I may run into them out in public, at a grocery store, in a restaurant, and they'll tell me, wow, I feel so much better now that I really haven't been in to see you lately because I just don't need you anymore. And this is universal. I've been watching this for 25 years now. Patients do this over and over and over again. It always has to be voluntary, and it always includes these things. There are many other things you can do to relieve your pain or to try and improve your health. I'm not really going to go into these in this series, but if you can just follow these basic guidelines, I bet you get rid of 80% of what's bothering you, and you will completely transform your level of function. This is a starting point for what you can do to relieve pain. I hope this information is interesting to you, and if it is, please like the video and subscribe to this channel, because I don't know if this is useful unless you give me feedback. I will read the comments. I may not be able to comment or respond on all of them, but I will pay attention to them, and if there's information that needs clarification, I will review it, and I will try to get back to you in another video with further information. For now, just get up, get moving, and start taking care of yourself. You'll be amazed at what it can do for you.